Hospital is now offering a test to determine if you are at high risk for heart disease and if you need to be put on a strict aspirin regimen. KETK's Marlena Hamilton has our story.
The Food and Drug Administration said that aspirin is very useful for people who had prior heart attacks or strokes. But if you've never had a prior problem, aspirin might not be a benefit.
So if you've ever had a heart attack or a stroke, really you should be on an aspirin regimen chronically.
Dr. Kumar prescribes his 79-year-old patient 81 milligrams a day after she had a valve replaced.
Well, I felt great, and I really feel I was taking aspirin before. I had the heart problem.
So, for those confused if they should be on an aspirin regimen or not, even though they have never had any heart problems, there is a new test Trinity Mother Frances offers to determine if you should.
As a doctor, it's difficult to figure out which patients are at very high risk for having problems and which patients are at low risk.
It's called the coronary calcium score.
This is for mainly patients that have never had any problems before. And you get a CAT scan of their chest. And what you're doing there is you're looking to see how much calcium is in the walls of the arteries. If the calcium score is high, indicating a high amount of calcium, then that means that that patient's at high risk for future events, and that is a patient that probably would benefit from aspirin.
Dr. Kumar says he recommends this test for people 60 or older, or if you're younger and have high blood pressure, diabetes, or smoke. He says they've helped so many high-risk patients that wouldn't have known otherwise. Marlena Hamilton, KETK News.
A whole lot of farmers